Very good afternoon to all of you. Paper which I am going to present today is surgical outcomes of external DCR with flap versus without flap in acquired NLDO. Epiphora is a common problem for which patients seek consultation, and common cause for this symptom is NLD obstruction. And the standard of care for this disease is DCR, which can be performed either externally or intranasally. External DCR is still the gold standard as the success rate ranges from 80 to 95%. Traditionally, external DCR with flap is favored as chances of granulation tissue formation and fibrosis is less with mucosal apposition. However, fashioning of flaps and its anastomosis make this procedure very cumbersome and can result in torrential bleeding. So to avoid complications which are associated with flap DCR, external without flap has been advocated as it is a simpler procedure, less time is required and less bleeding is encountered during this procedure. But there are very few studies which have actually commented on this technique. So hence this study was undertaken to compare the outcome of external DCR with and without flap. So it was done at Army Hospital Research and Referral. It was a prospective comparative randomized study. It was done for 2 years. Patients diagnosed with NLD obstruction were included and consent was obtained in all cases. 116 patients were enrolled and 58 in each group were allocated. General ophthalmic examination and nasal assessment were done and lacrimal drainage system was evaluated by doing the regurgitation and the lacrimal irrigation test. Monk score was used for monitoring and grading epiphora. We modified our technique of lacrimal irrigation test as we used 1 ml of syringe with 27 gauge cannula and the syringing was done through the opposite puncta after dilating the puncta itself, and NLD was obstruction was diagnosed when there was a regurgitation from opposite puncta after some time. So in DCR with flap technique, after giving a curvilinear insection, orbicularis muscle was dissected, then periosteum was lifted, then lacrimal sac was elevated, then osteotomy was made, then lacrimal sac was incised to create anterior and posterior flap. In the similar fashion, the nasal mucosa was also cut posteriorly to form anterior and the posterior flap. So anterior flap of nasal mucosa is anastomosed with the anterior flap of the lacrimal sac. So in DCR with the flap technique, both the anterior flaps are preserved. Whereas in DCR without flap technique, after excising the posterior flap, the anterior flaps are also excised, leaving a small stump of lacrimal sac around the common canaliculus. So all patients were evaluated on day 1, 1 week, 1 month, 3 months, 6 months and 1 year. So primary outcome measures were assessed subjectively by using the Monk score and objectively by doing the lacrimal irrigation test, and secondary outcome measures were complication in each group. So mean age of the study population was 48 years in group A and 49 in group B. Female were found affected in the both groups. In group A, left eye was involved in 28, right eye in 24, both eyes in 6 patients. And in group B, left eye was involved in 28, right eye in 22 and both eyes were involved in 8 patients. Watering was the common clinical presentation. Anatomical outcome was assessed by doing the lacrimal irrigation test, which was found patent in 94% of clientele in group A and in 91% in group B. And at the end of 1 year, it was 89% in group A and 84% in group A. So the difference was not statistically significant. Functional outcome was assessed by doing the Monk score. Monk score of 0 and 1 was considered as a successful outcome. Functional success rate was around 89% in group A and 86% in group B. We also compared the pre and post operative Monk score, which was around 3 pre-operatively. On day 1 it was 0.9 and at the end of 1 year it was 1 in the both groups. So again the difference was not statistically significant. Common complication was excessive bleeding, followed by the loss of sac and nasal mucosa. Epistaxis was found in 6 patients and non-patent lacrimal irrigation test was found in 3 patients in group A and 5 patients in group B. So our study demonstrated that external DCR is an effective procedure as we could achieve good outcome in 91% of our clientele, which was in conformity with Takashi, Mansoor, Bhaskar et al. As they also concluded that DCR without flap has the same surgical outcome as DCR with a flap technique. So this study is the second study from Indian subcontinent which has exclusively compared the external DCR with flap and without flap. This is the first study which was not only prospective but randomized in nature. The main limitation was a small sample size and short follow-up period. So to conclude, flapless DCR is an effective treatment modality and is a viable alternative to conventional DCR. External DCR without flap is an easier technique to perform and which can be done by most general ophthalmologists and residents. and failed DCR cases in which fashioning of mucosal flap is a Herculean task can be tackled effectively with this technique. These are my references. Thank you.
Thank you, madam. What is your experience about the failed cases? At what time you want to repeating the surgeries?
On the day one or after?
No, after that.
We did like in all the cases like post-op on day one, we do the syringing
I'm not talking about free syringing. You are repeating the surgeries again.
Yeah, for like in
At
all
what
the
time?
cases where like we didn't get the successful outcome, we repeated the surgery
At what time?
around 6 to 8 weeks.
What is the specialty of your study? Because there are so many other studies also that flap with flap or without flap. What is your it is just add-on or something specialty you want to say?
No, like from Indian subcontinent, like I have already mentioned, this is the second study and it's a randomized. Like no study was done from our country till date. And second, it is a randomized. We did a RCT. We like in both the groups we allocated same number of patients and then we found out that both the techniques are comparable. But in compared to the DCR with a flap, like for the novice surgeon or for the resident and those who are new into the field, like and in case of failed DCR, like fashioning of mucosal flap is very difficult, like most of the time it is not there, so in that case it becomes very handy if we perform DCR with a without flap technique.
Very nice experience. Only thing is that limitation is that your sample size is very small.
Yeah, actually we are a tertiary care center and we get patients like all the patients are being referred from the other center, so as such the oculoplasty load at our center is less compared to the other hospital.
So, Dr. Sonali, I wanted to ask that whether have you compared the number of cases which were successful without flap, without flap technique, which were the primary cases, versus which were the failed cases? Have you compared those?
No, that study is going on, but in this study, we like all the primary cases were included, like all the fresh
Because
cases.
I feel in failed DCR cases, the mucosal lining is not well preserved and it is actually not well maintained. I don't think that without flap DCR in a failed DCR should be as successful.
No, like we are doing one more study in which we have included only the failed cases of DCR. So what we have found actually the mucosa both the nasal and there means missing and the fibrosis also takes place. So we have to literally remove the bone again, but mucosa are missing. So in that cases this technique comes very handy.
So I think both that you should carry on this study for many more years to come, since you have all the
maybe the follow-up is
yes.
was less, like it was only for 2 years, but if the osteotomy is not proper, fibrosis can granulation tissue formation can occur anytime, like it can happen after 2 years, so long follow-up is required. So that is the limitation that we have mentioned in our study.
I think you should have added one slide of inclusion and exclusion criteria.
That I have included.
yeah.
It's like all the like failed DCRs that
Yeah.
we excluded, and all the cases with some nasal pathology, like septal pathology,
yeah.
polyps, and all those were excluded from our study, which I have included.
Right, okay. Thank you.